Hey everyone, welcome to Wednesday Night Live. Ron Vitale with Siskiyou Vital Medicine. I think I've picked up the bug of not being able to speak. We were having a little fun earlier laughing about not being able to speak properly, and here it is. So let's start that over. Wednesday Night Live, Ron Vitale with Siskiyou Vital Medicine. I'm our nutrition and lifestyle coach here, and we are a direct primary care naturopathic clinic in Medford, Oregon. And our goal is really to create a wellness culture here, and that's something that we've been dedicated to. Dr. McLean Duncan, the founder of Siskiyou Vital Medicine. If you've watched in the past, you've seen us talk probably a lot about the desire to create a wellness culture and also to bring down the cost of healthcare, or to provide affordable naturopathic primary care to the Rogue Valley and hopefully beyond. And today, as you can see, Dr. Duncan is not with me, but I have somebody that I am so excited to have here with me. Totally like one of my favorite new friends ever. This is great. Terra McDonald, she is a craniosacral therapist. And there goes the water I just spilled. So she is a craniosacral therapist here with us. She just joined the practice. How long ago? July. Mm-hmm. So she is practicing here with us 1 day a week right now for since July. So we're totally excited to have her here. And tonight you're going to get to learn a little bit more about Terra and what craniosacral therapy is, and how she got into it, and a little bit about her. So welcome to Wednesday Night Live.
Thank you.
You're welcome.
Yeah.
Yes. So tell us a little bit about what is craniosacral therapy?
Okay,
Yeah.
It's a good question, and lots of people ask me that. So craniosacral therapy is actually a very light, subtle form of doing therapeutic body work. So it's a hands-on approach to working with the body, and it's very much a direct link into the nervous system. And really, once the nervous system is functioning properly, it actually helps the other systems come online a little bit better. So it's almost, basically like the master board for the rest of the systems. So like we have a pulse or a heart rate, a respiratory rate, we also have what's called a craniosacral rhythm, and that's the rhythm of the spinal fluid. So as the cerebral spinal fluid flows up and down the spine and through the cranium, it acts like a pressure stat model, so it fills and it empties. And so the cranial rhythm is basically the cycle of that. So you can actually palpate it on the body as a flexion extension movement. But it's subtle because the cycle of it is pretty slow. So you'd have, maybe at resting heart rate, you'd have 60 beats per minute. This is a whole cycle. In 1 minute you might have 10 cycles. So it's a lot slower. And so it actually, the point of craniosacral therapy is that the body knows what it needs for self-healing. It knows what it needs to do to come back into homeostasis. So it's about being neutral as a practitioner. And so you're basically listening to the tissue, so the fascia, the muscles, the bones. You're listening to the tissue, and you're following it where it actually is wanting you to go. Instead of kind of imparting that I think I know what that person's body needs. It's really about deep listening. But it's also about helping regulate the spinal fluid. So 2 ways that I'll explain it to people depending on what's going on for them is I might explain it as that it's like getting an oil change. So you're actually lubricating the spine. So as you're creating space between the vertebra and as you're creating space in the bones and the sutures up in the head, you're actually allowing for the fluid to move a lot better and a lot more efficiently and smoothly in the nervous system, in the dural tube and up in the head. So it does feel like, almost like sometimes I've had that feeling when I've been worked on, like, wow, my engine's purring, So it really does kind of bring a lot of vitality into your system. The other way I talk about it sometimes is sometimes our whole system, like the immune system, can really be off. There's so many autoimmune dysfunctions out there now. And so the immune system can be so far off that the whole system just needs a shutdown. Like your computer is going wonky and you can't even shut it off with your mouse. You just have to just either unplug it or push the button.
Mm-hmm.
So sometimes that's what happens within the cranial system too, is that things can maybe be so off that you can induce what's called a still point and sort of help the whole system shut down for a moment. And what that means is the whole cranial rhythm turns off.
Wow.
So things stop for a moment, and then you just kind of wait, and it will actually come back on.
It'll reboot, and it will keep,
yes.
like, say, a healthier rhythm.
Yeah.
Interesting.
Yeah. So, and those are kind of magic moments. They're actually really neat when they happen. And sometimes they happen on their own. And sometimes if something is feeling like, almost like if you're chasing something, you can kind of induce a still point and help everything just kind of quiet down for a little while.
And what might a person experience in that?
Absolute peacefulness. It actually feels so good. It's quiet. It's sort of like the space between the breaths.
Mm-hmm. It sounds like something a lot of people could use right now. With the amount of stress and the high-paced life and the hyperstimulation.
Yep.
It sounds like that pause or that rebooting is something that people could really use.
For sure.
So how did you get into craniosacral?
That's a good question. So I have a son that's 20 years old now, and when he was 6, he was in a Waldorf school, and he wasn't tracking right left very well, and he was still just having some issues of not really being in his body. Super brilliant, but we'd even call it, Henry's world. He was really fun, but he had just amazing focus, and probably, I think there were questions at some point that he might have been on the spectrum, and I didn't really think that was what was it. But we had someone come down. I lived in North Idaho, and we had someone come down from Nelson, British Columbia, and do assessments, and they suggested that he be one of the people that gets this assessment done. And there was a big questionnaire, and at the beginning it was all about what was the birth process like. And we had kind of intense birth process. I was doing a home birth, and I had 104-degree temperature, 13 days late, and I had full-blown beta strep, and we hadn't been tested for it. So we just kept riding it out as long as we could, finally ended up in the hospital. And then he turned posterior, ended up having a big to-do birth. Did not know about cranial. I'd never heard of it before. So when he was 6, when we filled out the questionnaire, they did all the assessment, it came back and it said one word of the to-do was craniosacral therapy. And I was like, I was in a 7,000 person town. What is craniosacral therapy, and would we even have it here? And so we just so happened that someone that worked for us, her mother was an amazing cranial therapist she was a registered nurse and worked with an osteopath, and she was there packing up her house and moving to Seattle, and she worked on Henry, and in 3 sessions I literally watched him come into his body. Like, I watched it after the 3rd session. It was a couple nights, and we were in our bedtime routine, and he just talked, and all of a sudden it was I saw him like almost incarnate.
Wow.
And he locked in, and that was it, and it changed all of our lives. It changed his life, it changed our lives. But I knew the very first time I took him in to have a session, she just put hands on him, and it doesn't look like much. It's a very still type of modality. And she just laid her hands on him, and every cell in my body said, this is what you're supposed to be doing. So I asked her where she learned originally and who I should go study with, and she said, go to this, group, and I found a class in Missoula and took it like 6 weeks later.
Wow.
And that was just the beginning of it, and, just really practiced the first level for about 1.5 years before I went on. I just told everybody who I knew, if you want, I just would love to practice, and so I just did it like that for a 1.5 years.
Wow.
So anyway, and then once I got into the next class, then I was like, oh, this is what cranial is about.
So
and then I really went into it. So it's just been my passion, and I still feel like I learn something every day. It's just been a love affair that just deepens. I think it would be equivalent to someone who really studies yoga. Like, there's no end to it. Like, it just keeps going, and it's evolving process.
Wow. So. Yeah. So it's as deep as you want to go.
It's another way of life. To me, it feels like meditation when I'm giving a session many times, and it's such a deep connection with with someone because you're listening so subtly
Right.
to what's happening that you just kind of end up in this melded place with someone that is meditative.
Yeah. And you can actually feel the rhythms with your fingertips. The
Yes.
rhythm of the spinal fluid with your fingertips.
You can.
That's amazing. And then, I mean, I had a
I
session
have to
where
tell you, a couple of years ago, I got into a curriculum that's all about the immune system. So I work at a hospital in Southern Oregon.
Right.
And so I thought, this would be a great curriculum to just learn a little bit about. And we learned about the immune system, and we learned how to palpate cells. So you can actually feel pretty much anything in the body if it's actually moving in the cranial rhythm or not.
Wow.
It is the most amazing thing. So it's really working directly with the person's inner physician or their inner wisdom. And it's a way of communicating through the cranial rhythm. And you can ask questions, it'll turn off or on. I mean, it's really pretty amazing. It's a beautiful practice.
Wow. And I just need to know, like, where was this born out of? Like, what's the origin of this?
So it actually came out of osteopathic medicine.
I was wondering. Okay.
Yeah. So there's one original man, his name is Sutherland, and he was an osteopath. And he basically was the one who kind of figured it out. And he would do all kinds of tests. And his wife, he would put like helmets on his head, and he'd take them off. And he had, I mean, the stories, I've heard a few stories about. I guess he was just pretty awesome. So he just got into it. He just kind of discovered that there was this other rhythm in the body.
What time frame was this?
Oh gosh, I can't really say. I want to say that it was probably the early 1900s. Yeah, 1920s maybe, somewhere in that realm. Could have been a little later, maybe 1940s. I don't know, somewhere in the earlier part of the 1900s.
And this is now like
I should know,
a really well accepted therapy now.
It is.
I mean, you're practicing in a hospital environment as well. So
yeah,
this is.
It's been pretty phenomenal. I just feel like and there's so many schools. We have someone just in Southern Oregon who is teaching, who I think he may have directly studied under Sutherland, Hugh Milne. He's now teaching in Southern Oregon, and there's lots of other schools and there's lots of other schools and branches of cranial. There's biomechanical, there's biodynamic, there's esoteric. So, you know, the range of it's really spread out as it's grown and become more accepted, and more people are doing it. So it's pretty neat.
That's really awesome.
Yeah.
That's so awesome. And did you have a background in healing arts prior to getting into craniosacral or any kind of alternative therapy?
That's kind of a neat question. It's a great question. I was living in North Idaho, and in Idaho we didn't have licensing for touching your body, so for massage or any kind of body work. And so I had studied Reiki, and I had done some other practices, and I did pranic healing. So when I got into this, I was actually coaching. I was a coach for probably 10 years before
like a life
this
coach?
came in.
Okay.
Yep, it was a family business that we did personal development seminars and traveled and did like 4 to 7 day seminars, and so that was really my background. And I had a little bit of energy work that I had just more for myself, had just kind of was curious about. So when this came in, and I think it was easier for me because I know a lot of massage therapists who have studied it and have a hard time transitioning over because a lot of times their patients love the deep tissue and want to keep doing the deep tissue. So for me, I didn't have that background.
Right.
So, and I was able to work right away with patients because I didn't have a licensing issue at the time. They do have licensing now in North Idaho, in the state of Idaho. But then when I moved to Oregon 6 years ago, I went to the Ashland Institute of Massage, and I got my massage license through the board and did the whole legit. So it was really fun to come back and bring in the kinesiology and the pathology and bring this whole other part that I'd kind of done some self-study, but really to have the formal training just brought it to a whole nother level. And then by the grace, I don't know how I ended up at the hospital, but I'm so grateful because that brought in a whole nother piece for me of being able to touch so many bodies and work with so many different pathologies. So it just it accelerated my skill level as, you know, being able to palpate and the different things and what they feel like as far as pathologies in the
So
body and how that affects the cranial rhythm.
And you, so would you say that different pathologies affect the cranial rhythm in different ways?
Definitely.
And you can you detect the rhythm and go and kind of feel into?
I wouldn't know what the pathology is necessarily,
right?
or I mean, I probably wouldn't. Although I don't know, I've not actually tried to do it that way. Usually, I'll ask somebody what they're there for, or sometimes I won't, and I might feel something going on in the body, and I might be drawn because of the cranial rhythm to a specific place, and they'll say, "Oh yeah, well I had this, I severed my collarbone," or so oftentimes the body will also take us there.
It lets you know the great wisdom of the body.
Exactly.
Yeah. Wow. It's so much about honoring the wisdom
it really is.
Of the body, which is, I mean, that's really like a spiritual pursuit even. So beautiful.
Yeah.
Oh my God.
Yeah.
So what benefits could people expect with craniosacral therapy? Or not maybe expect, but what benefits could somebody experience from craniosacral?
Yeah, so I'll tell you some of the things that I see fairly often in my practice. I love working with TM joint disorders. Lots of release in the avenue of expression and in the mouth. We just hold so much tension, and people clench, and we have a lot of like people who sleep in the evening. Oftentimes that's when those things happen, so they're not aware of it unless they go to the dentist and the dentist says, "Oh, it seems like you're clenching down." So that can be super helpful. Migraines often come from jaw issues, or neck issues come from jaw. Love doing internal mouth work. But there's this whole other piece because it is the avenue of expression.
Yeah.
So oftentimes we're locked up here. So it's really fun, and I like doing jaw work because the results are fairly quick. Like you can feel something pretty quickly.
Right.
It's always nice to have some feedback.
Some instant feedback.
Yeah,
right. Like, oh wow. It feels better already.
Same thing with like SI joint disorders. That can be really helpful, just to help bring some spinal fluid coming back into that area. We get a lot of compression in the neck is heavy, so gravity pulls it down. So there's lots of compression at both ends of the spine. So I really love working with those kinds of spinal issues. I would say digestive problems as well. Pretty much anything. Sleep issues, oftentimes that can be a circadian rhythm issue. So if your suboccipitals up in the occipital base area are really tight, it's also affecting the nerve that is related to your circadian rhythm. So sometimes that can be something that can really help. I had one really interesting case of a surfer who was here visiting his family from Hawaii, and he was in his mid-20s, and he hadn't had his sense of taste or smell for 3 years from the time that the board had hit him. And so I did a little research first, and I asked around, and I kind of thought, okay, well, this will be fun. Let's just see what happens. And after he had his first session, he went home, and his mom was cooking dinner, and he didn't have any of a sense of taste or smell. And he said it came back about 50-60%. He was able to smell the food when he walked in. Like, it was that immediate. Wow. And not everyone is that way. Not everyone's going to feel. We all respond differently. But that was kind of a fun thing that I hadn't done before. And then I just saw him last year at Christmas time. I went down and visited the family in Hawaii, and he has almost all of it back. And he's had he did more sessions because he realized, oh, this could be something that could be maybe, he could get it back. So that was kind of fun.
Interesting.
Yeah. So there's a variety of things. Trigeminal issues. I do a lot of nerve work as well.
What about like autonomic nervous system disorders or disruptions or vagal nerve?
A lot of vagal nerve issues. Yeah, that is super helpful. I mean, just in itself, structurally, your foramen, the jugular foramen, has 3 different. It's a tiny little hole. And it has the carotid artery, your spinal accessory nerve, and it has the vagus nerve all come through there.
Mm-hmm.
And just like things can get twisted in tissue, like our fascia, nerves can get twisted. Nerves can get compressed. If we're tight, we're clenching our jaw.
Right.
That's going to affect the bone and the space that those nerves are coming through. So it can create some neck issues down into the shoulder. It can create issues with the vagus nerve.
Right.
Definitely see that in children. I work with babies as well with that birth process. Sometimes those things can get a little wonky.
It's almost like it would be nice, like after birth, to have just a prophylactic craniosacral session, right? To get everything.
It's so fun to work on babies.
I mean, whether the birth goes easily or not, it's a traumatic experience.
It's true.
Right?
Yeah.
Whoa.
Am I allowed to put a plug in?
Totally.
Okay, so so myself and 3 other practitioners in Southern Oregon, we have a free infant clinic that we do for pre-crawling infants.
Oh, really?
And and you can get in touch with me. But it's by schedule. We do it at the Family Massage Center in Ashland, and we fill up. But it's a great opportunity to bring. So our next one is on the 26th of October.
Excellent.
So we do it from 12 till 4. But it's been really fun. We've been doing it for 3 years, and it's just grown. And it's one of those things that
what a sweet service.
It's really great. Yeah. So if you have a baby or know somebody who's having a baby, it's just a wonderful opportunity to help their nervous systems come kind of back in line. And what I've learned with working with adults too is we usually have some sort of initial nervous system response that kind of carries through if it doesn't get soothed at an earlier age. It's just, whether it's an easy birth or whether it's a challenging birth, that if we can correct that initial imprint of the nervous system imprint, that it can make a huge difference in so many ways for your health. And for learning, especially with babies, the whole learning piece, because it's how the dura is shaped, really,
It's just the thought of that makes me wish that I did that with all 3 of mine.
Oh, me too.
Right? It's like the
but
things
it's never
in
too late.
retrospect, right?
Yeah,
Like
it isn't too late.
So you're here now at Siskiyou Vital Medicine on Wednesdays, so people can book appointments with you here on Wednesdays. And you're at the hospital in Ashland. What days?
Mondays and Tuesdays.
Mondays and Tuesdays.
So if you're going to end up there, plan around that. No, we don't want to say that. You
got to go to the hospital. Make it a Monday or a Tuesday.
No, we don't really want you to go into the hospital.
You just do it for people who are actually patients at the hospital.
Exactly.
Like, people don't book a session with you at the hospital.
No, they don't. Maybe someday.
No wonder you looked at me like that. What are you saying?
But someday, then maybe they'll have maybe hospitals. I can only dream.
Right. That they'll really bring preventive medicine.
Wouldn't it be great? I mean, if anything at all, I have that dream of wouldn't it be great if all babies that came into this world had the opportunity to get cranial right away?
Right.
Yeah.
Absolutely. To start off, if we were taking care of each person right off the bat at that level. Yeah. Amazing.
I mean, the bonding that happens, because it can be so helpful for nursing issues right from the beginning. So that creates such a relaxation for the mom, and the baby's able to latch on, and that bonding happens so much quicker that it really is it's great for all 3 parents, for the whole process. So it's fun. I have to say it's definitely one of my passions.
That's great. That's great.
Good stuff.
I can say personally that I have had a session with you, and it was an amazing experience. So if you are looking to get some deeper healing, or you have some TMJ, or any of the things that Terra was just talking about, I would highly encourage you to come in for a session, because I have chronic neck issues and back issues, and the session that I had with her was such an amazing, amazing experience of relaxation. Also, just feeling relaxed and yet rejuvenated all at the same time, and focused and energy, and it was really nice. And there was also that really lovely experience of somebody playing harp there too.
That
so
was nice.
that was nice. The added bonus. But
that we have to dream into.
Yeah, we call that one in a little more. But so please come check out Terra's work here at Siskiyou Vital Medicine. Is there anything else you want to say, or anything else you want to share? Like, how can people contact you if you want to do that, or they can put posts up in the comments, and then you can respond in the comments?
I can do that, and I'll also have my information to you as well, so I'll be on the website.
That's right, you'll be on the website.
Yeah,
so
that's coming today.
Upcoming soon. You'll see her on the website.
Yeah.
But anything else you want to share?
I don't think so. Thank you so much, and it's such a gift to be here. I can't say enough about Siskiyou Vital Medicine, the clinic, and all of the people that work here. It is just a dream, and I'm so happy. I mean, I don't know if Wednesdays is going to be enough for me, so we'll see what happens. And I love coming to Medford. I'm so, it just is so welcoming and so warm, and the vision and the mission of, what this is about is just so beautiful, and I feel so grateful to be here.
Oh, we're so stoked to have you here.
Thanks for offering this.
Oh, absolutely. This is so much fun. It's just what a great way to get to know you and your work.
Yeah.
And I know I can speak for all of us here that we're so happy to have you here.
Thank you.
So that's great. Another wonderful addition to our dream team here at Siskiyou Vital Medicine. And that's it for another Wednesday Night Live, everybody. Join us again next Wednesday, 5:30 here on Facebook. I believe Dr. Dunklin will be back with me. It'll be the two of us talking about something interesting, I'm sure. So, but until then, thank you for all of your support and tuning in. And thank you, Terra.
Thank you.
All right. Bye, everyone.
Bye-bye.
See you next week.